Today we have Carol Kivler, an author and founder of Courageous Recovery, Inc., a nonprofit organization that advocates for mental illness recovery. Ms. Kivler will share her personal perspective on the essential ingredients of patient-centered communication and its importance in the mental health field based on her lived experience of recovering from treatment-resistant depression. Welcome to PsycU, Ms. Kivler.
Thanks for having me.
So to get us started, please share with us a little bit about your background and why you're so motivated to advocate for mental illness recovery.
Well, my background was, interestingly enough, I taught communication on the college level for at least a dozen years. And while I was teaching communication, I was brought to my knees with depression, major depressive disorder, and general anxiety disorder, which landed me in a hospital not once but 4 different times for treatment-resistant depression, which then we're talking about what patients need and, most importantly, how we can better patients' life when it comes to communication in the mental health field.
I think it's so wonderful.
Required that I had a treatment option that many people are very frightened of, and that is ECT, better known as shock therapy. But yet today, 16 years later, I'm now
told that you're on the recovery side of depression. So based on your lived experience, though, you've encountered firsthand what good provider-patient communication looks and feels like. Why do you think communication is so important? What are the goals for good communication?
Well, first of all, communication is the cornerstone of any relationship, and a patient-provider relationship is one that really needs communication, because without it, you don't know what's going to happen. I just want to tell a real quick little story that happened to me recently. I had changed doctors, and I went in and was speaking to the doctor for the very first time, and the doctor saw the medication I was on. It was a general practitioner, and her first question out of the chute when she saw my medication was, "Are you suicidal?" It took my breath away, because there were so many questions she could have asked me prior to that particular question. Yes, the question needs to be asked, but it needs to be asked after a series of other questions.
Well, I was just going to say that might not have started out on the right foot.
It actually started out on the left foot, and I ended up writing a letter to her and leaving the practice. So we answer the double question here. What were the goals of a good provider-patient communication here? And I wanted to just say the first goal is to build trust, because, as I said, communication is the cornerstone of a relationship. So a trustful relationship is a solid relationship. Another goal of patient-provider communication is to really have an exchange through interaction. So it's a give and take. It's a two-way communication versus one-sided communication. And the third goal is really to involve the patient as much as you can in the decisions. So it's a question and answer, as well as helping a person make the most informed decision that he or she could make.
So then there must be some approaches that work better than others, in your opinion. Can you give us a few examples?
Sure. One of the approaches from my experience that works best is what we call the ask, tell, ask approach versus the tell, tell, tell approach. The tell, tell, tell is one-way communication, and it doesn't work. It's very ineffective. The ask, tell, ask-based communication style is where you ask questions to find out what your patient already knows, so that you have a baseline from which to answer or to give informed information to the person. And so you might ask questions on, how much do you know about your illness? Do you recognize the prevalence? What kind of information are you looking from me to understand your diagnosis more? Once you start that and you ask some just basic questions first so that you develop a little rapport with the patient, and then you can go into telling the patient the information they need to know. But the real key in telling the patient the information they need to know is to tell it in a way that's easy for the patient to understand. Now, just recognize that during a depressive episode, it's very hard for the person to really comprehend, because it's hard for concentration. So for you to be able to give it to me in a way for me to understand it. And then you follow it up with asking your patient questions concerning the information so you can gauge how much I've understood.
So that's pretty interesting. Then what do you think about written materials given to a patient? So for example, something, maybe a one-pager that describes someone's condition or the medication side effects they might experience. Do you think those are effective communication?
I think they're effective communication in the right time. When I am in the throes of my depression, it's very hard for me to read. I can't even read a sentence and concentrate enough to understand what it said. That information is very helpful if it is given to me when I'm starting to come out of the depression and I have the capability of concentrating enough to read something. And hearing information and then seeing information increases retention of information. It just has to be timed right.
That makes a lot of sense. I have a point of curiosity question for you. During your treatment, was there ever any electronic communication with your provider, any emails or anything like that, or was it mostly face-to-face?
No, it was 100% face-to-face. And there were a few phone calls in between. No, I didn't have her email. Now, I know that therapists are using today telephonic therapy. I hear a lot about that today because there's not enough providers in the area, so they're using it telephonically. And I've also heard that I actually have a therapist friend who she does a lot of her therapy through email because they're overseas and they're dealing with that. So there are, just like all technology, we're using technology differently than we have in the past. But for me, I didn't use anything other than telephone and face-to-face.
Do you think good communication skills are innate, or can they be learned? And I guess maybe referencing providers and patients alike. What do you think about that?
Well, as a person who's taught communication for probably 40 years, I believe it's a learned skill. Some people are naturally better communicators than others because they've had good role models, and so they were able to mirror the communications that they've seen the role models utilize. However, communication is absolutely a learned skill. It's awareness and then the ability to accept that I need to get better at doing that, and then to make a commitment that I am going to commit to being a better communicator.
So then you brought up the topic of skills. What skills should providers master in order to establish a good patient-centered communication?
Well, there's a number of skills. The first one is to learn how to utilize open-ended questioning so that you get to hear more than just a yes or a no or a maybe or very short answers. You want to really elicit information and get the person to talk. So open-ended questions are really important. The what, the how, the where. Also, learn to be a good listener. You know, we were given 2 ears and 1 mouth, which is we should be listening 2 times more than we speak. So actually learning to listen, really listen, and then paraphrase back what it is that you've heard would assure the person that you understood what he or she has said. Also, another good skill is really treating people in even communication respectful and letting the person maintain his or her dignity when it comes to the mental health. And I go with that when as easy as something as I remember being in a hospital for a physical ailment and the door was closed and there would be a knock on the door before the person would enter. When I was in the psych hospital, they never knocked. They just walked right in. You would think that's something very non-invasive, but it was very invasive for me because I felt like I had no privacy. I had no dignity. I had no respect. So a little human kindness goes a long way, even in the mental health field.
Ms. Kivler, this has been very instructive, and I want to thank you very much for sharing your personal journey with us. Hopefully providers and patients can learn how to communicate more clearly and effectively with each other to further their recovery. Thank you for joining us.
It's been my pleasure. Thanks for having me.